Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Well, one death every 11 minutes. That is how many suicides happened in the U.S. in 2022, according to the Centers for Disease Control. In today's Healthier Together for National Suicide Prevention Week, Christine Pitawanich digs into the numbers and looks at what you can do if you or someone you know needs help.
Suicide can be tough to talk about. Often people are worried about saying the wrong thing, or they just don't know what to say. But Jamie Vandergaan, CEO of Trillium Family Services, Oregon's largest provider of children's mental health services, says it's important we step out of our comfort zones.
To really say, what's going on with you? And I've noticed a change. Not being afraid to open up that conversation.
She says the problem of suicide is significant in Oregon.
You know, we consistently rank last as far as access to treatment.
Dr. Mike Franz, Executive Director of Behavioral Health at Regence, says in 2022, Oregon had the 12th highest youth suicide rate in the country.
Suicide is the second leading cause of death among children ages 5 to 24 in Oregon. And we've seen an increase in this rate in 2022, which was the first increase since 2018.
The increase in these types of behavioral health conditions believed to be correlated with social media and smartphone use.
So kind of 2010 to 2015 time range, we saw a real spike in the increase in behavioral health concerns among our youth.
This summer, the U.S. Surgeon General even asked Congress to require warning labels on social media platforms, similar to those on cigarette boxes, telling of its effects on young people's lives. And this week, Oregon's Attorney General joined the long list of AGs calling for the same thing.
I think as a community, we're finally realizing that mental health is health.
Both Vandergaan and Dr. Franz say there are a number of myths around suicide, too. The first, that it only affects people with mental health issues. Dr. Franz says more than half of suicides cannot be tracked to a diagnosable condition. Another myth, that most suicides happen without warning. This is not true. There are plenty of signals. We'll talk about those in a moment. And maybe the biggest myth of all, that talking about suicide increases the risk of it. Again, untrue. Studies have shown that having conversations with people you're worried about and connecting them with resources decreases the risk. As for warning signs, talking about wanting to die, being a burden, persistent hopelessness, giving things away, maybe mood changes could all be things to look out for. And if you or someone you know needs help, call or text the number on your screen. That is 988. It is the National Suicide Prevention Hotline. It is open 24/7. Christine Pitawanich, KGW News.
For more information and to watch all of our Healthier Together stories, you can visit kgw.com/healthiertogether.